Dr. Abraham Babu. He is an associate professor in the Department of Physiotherapy at Manipal Medical College, and he's an honorary research fellow, Department of Cardiology in Melbourne, Australia. Over to you, Dr. Abraham. We are all waiting to hear from you, and he's going to talk to us about how exercise and physical activity can help in managing pulmonary hypertension.
Thank you, Prashant. And it's a very humbling experience for me to be here. I think Dr. Vidisha has clearly highlighted what I'm going to talk to, and I think she's the perfect example of what exercise and physical activity in pulmonary hypertension can do when given well. To start off, that some of my conflicts and funding. I think, like all of you know, fatigue and shortness of breath are probably the two main findings that you would experience or difficulties that you experience. And of course, that is a downward spiral from there, that you can have difficulties in moving around, which sometimes in the end would affect your quality of life. Why exercise? Well, we all know that exercise has a lot of benefits, but getting people to exercise is easier said than done. And it is, even though we know all these benefits, it is not easy to get someone to exercise, and sustaining exercise is even harder. This was a wonderful paper which came out from the UK a few years, just last year actually. And the solid line is basically the normal course of disease with PAH. But what is postulated is that when you add on a rehabilitation to optimal drug therapy, that there could be a rise in function. And that is something what exercise and physical activity aims to target. And a lot of these start with an evaluation. Now, Dr. Vidisha also mentioned that a cardiopulmonary physiotherapist is the right person to do these tests. Many of them can be done very easily in a clinic, do not require a lot of expertise or do not require a lot of equipment. The simplest being what is known as a 6-minute walk test, which can be done, and all you need is a 30-meter corridor. A little more advanced would be a treadmill test or a cardiopulmonary exercise test, and this is usually decided by your cardiologist. In advanced centers in India and abroad, you may have centers performing what is known as an exercise echocardiogram, where the cardiac function is assessed during exercise, and sometimes more advanced settings like an invasive cardiopulmonary exercise test. But I just talk a little bit about the 6-minute walk test, which is a very simple test to do. Many of you may have already done it. It may be known. And it's all you need to do is walk 30-meter corridor, walk as far as you can in 6 minutes. And you will be supervised through the test to ensure safety. And these distances are monitored regularly and help the clinicians and cardiologists as well. And it also gives an idea to a physical therapist or a physiotherapist who's there to gauge the progression and alter and tailor the exercise programs that are being given to the patient. These are some of the prescriptions that we follow at our center in Manipal, where we have developed a specific pulmonary hypertension manual, which was funded by the Pulmonary Hypertension Association, which includes a set of active exercises which patients can do at home. Very simple to do, and these exercises are progressed as time goes by, usually every couple of weeks. And on the box here, you see that patients can also perform various walking exercises. And we start small and we build up. And obviously, the final target being that we would like for all of you to be able to walk at least 40 minutes. But if not 40 minutes, at least the maximum amount that you can do with, as far as you are comfortable with, without an exacerbation in symptoms. Since Dr. Vidisha talked about what happens to mental health, I thought I'd just throw the slide right in. And participating in rehab or in exercise training, and this was results from a study which we did recently, showed that the mental component benefits much more than the physical component. And I think Dr. Vidisha has highlighted that in her example, in her testimony. And that is something which we would like to target and improve your overall well-being. Of course, we also like to see other parameters improve. Various forms of exercise training are available. Some of you may have heard of something known as inspiratory muscle training, which is a training method that improves the strength of the diaphragm. Now, there aren't too many studies. There are a few studies in this area. And based on the diagnosis of pulmonary hypertension, based on your group in which you're classified as, There may be benefits with various strategies of exercise training, but irrespective of the group to which you belong, aerobic training, simple walking exercises, active exercises are extremely beneficial. Physical activity. Now, this has become the norm. Every phone, every smartphone has an activity tracker, and people try to see how many steps they can do. And a lot of times, the target is 10,000 steps. Now, for many of us, it may be an unrealistic target, but nevertheless, the WHO has suggested and recommended a few guidelines to promote physical activity. And what they have suggested is that you participate in about 150 minutes of moderate intensity. This seems to be a lot, but when you break it down, it's actually 30 minutes per day for 5 days. And you don't need to do these 30 minutes at one go. These 30 minutes can also be broken down into 10-minute bouts. And you can do that thrice a day. So you achieve 30 minutes rather than having to do 30 minutes at one go. You can actually break it up into morning, afternoon, and evening, and you achieve 30 minutes of exercise a day. As far as the number of steps go, it is good to start with lower limits so that you don't push yourself too much initially, and then you can slowly build on as you go. Muscle strengthening using simple weights, like even a 500 ml bottle of water at home, is the easiest way to start. You can start by filling it up half, using it for your hands and for your shoulders, which are also useful and help in building endurance. The American College of Sports Medicine has prescribed or has given a list of activities that are available online. And this is free to access. Anyone can look at it, and it'll give you a list of various activities that you can do. And obviously, the goal of any activity that you do is that you find it enjoyable and that you like doing it. And also, of course, in the current era, you also make sure that it is keeping in norms with social distancing and what you can do staying at home. So how hard should you be exercising? Well, this is a simple tool which can be used to gauge the intensity of how hard you should exercise, and this is known as the Boggs rating of perceived exertion. Now, it starts from 6 and goes up to 20, and it's self-explanatory. It describes the exertion that you feel, and most of the time, we target a level between 11 and 13, which is light to somewhat hard. And you can gauge that. Sometimes it may be just walking a little faster on level ground may make you feel somewhat hard, in which case that is the maximum level to which you push. Any exercise, any activity you do should not make you feel hard or very hard or severe exertion at any point in time. So it can be a simple task as just going to the bathroom, changing your clothes, anything, any activity that you do can be rated on the scale. And that will help you identify activities which you should avoid, identify activities which you can do in a safe manner. When do you need to stop? Obviously, if any of your symptoms become worse, it is an indication for you to stop any kind of activity or exercise and rest and contact your physician if your symptoms do not subside. You may also need to visit the hospital if you are not up to the mark. To summarize, what I would like to say is exercise is important in PAH. Anything is better than nothing. Even the little bit you do goes a long way. Ensure that your symptoms do not worsen during activity. Discuss with your doctor before starting exercises. Consult an exercise specialist, preferably someone with a cardiopulmonary physiotherapy background, for an appropriate prescription to exercise. And most important, stay motivated. There is always hope. Thank you for your attention.
Thank you, Dr. Abraham. That was an excellent presentation. It gave an insight as to how exercise is not only important for your physical but also your mental well-being.